Depression is the most common mental illness affecting over 300 million individuals worldwide. It is a mood disorder that can cause significant disturbances in an individual's life and can have severe psychological and somatic effects. Depression symptoms can manifest themselves differently in each person but are similar. Signs include but are not limited to a lack of interest, disturbance in sleep patterns, change in appetite, mood, cognitive function, and weight loss or gain. Numerous factors play a role in the cause of depression, such as neuronal or hippocampus damage, stressors, past abuse, death, medication, chemical imbalance, environment, and genetics. Regarding depression, I will focus on three neurotransmitters from the monoamine family, which are serotonin, dopamine, and norepinephrine. Serotonin has several different essential functions throughout the body, such as regulation of sleep, appetite, mood, memory, and regulation of body temperature. There are 14 different types of serotonin receptors, and it is a derivative of the amino acid tryptophan. Serotonin is a contributing factor of relapse of depression because of the depletion of tryptophan. There is evidence that tryptophan depletion plays a role in the relapse in patients who are recovering from depression. According to Cohen and Browning, low serotonin function may compromise mechanisms involved in maintaining recovery from depression rather than having a primary effect to a lower mood in all vulnerable people. Dopamine is another neurotransmitter that is associated with depression. Dopamine has 5 different types of receptors among 4 pathways. Each of these paths have distinctive functions in regulating things like mood, motivation, pleasure, motor control, cognition, and emotions. One of the dopamine's purposes is to control arousal. Neurotransmitters associated with sleep may not be turning down awake neurotransmitters, causing you to stay up. Dopamine receptors are abundant in critical structures of ascending reticular activating system, including the dorsal and median raphe nuclei and the ventral periaqueductal gray, which are critical in modulating sleep. This is one of the reasons why people who are depressed may suffer dysregulation in sleep patterns. One of dopamine function is pleasure, and we must consider anhedonia, which is lacking the ability to maintain satisfaction. Anhedonia is considered to be a core feature of major depressive disorder, as it requires that either depressed mood or anhedonia be present to propose this diagnosis. Anhedonia would be a fundamental concept to consider why a person lacks interest in certain activities that once excited them. Anhedonia has been studied extensively in not only major depressive disorder, but also in schizophrenia and Parkinson's disease. Lastly, norepinephrine is also linked to depression and produces an alerting, focusing, orienting response, positive feelings of reward, and analgesia. One of the main functions of norepinephrine is the fight or flight response. Epinephrine, the cousin of norepinephrine, is a hormone that binds to the same receptor as norepinephrine, and both work together to activate the sympathetic nervous system. The sympathetic nervous system triggers the fight or flight response. Norepinephrine is directly involved in such regulation of stressors of anxiety and depression. One common treatment of depression is antidepressants. Antidepressants work to regulate neurotransmitters such as serotonin to help alleviate mood, emotions, anxiety at the cellular level, to promote neuronal survival and reverse stress-induced neuronal damage. There are 3 types of drugs that are used to treat depression, which are TCAs, SSRIs, and SNRIs. TCAs are first-generation antidepressants, and SSRIs and SNRIs are second-generation antidepressants. SSRIs are the most commonly prescribed and work to increase the serotonin levels in the brain. Antidepressants typically take about 2 months or to take effect on an individual, and are usually taken for 1 to 2 years. Antidepressants such as Zoloft, Prozac, Cymbalta are some SSRIs. SSRIs are known to commonly cause thoughts of suicide and can also be the cause of dizziness, nausea, insomnia, anxiety, and loss of libido. Various studies suggest that teenagers consider suicide more often than taking SSRIs and SNRIs, and also actually attempt to take their own lives more often. 20 to 100 individuals who take antidepressants have complete remission. Other treatment options are cognitive behavioral therapy, talk therapy, or virtual therapy. Another treatment option is deep brain stimulation, which is a surgical procedure to implant a device into a specified location in the brain and emits electrical currents through electrodes. The technique is a practice generally used for individuals who have Parkinson's disease, but research has ventured into treatment-resistant depression and other disorders with positive outcomes. Health risks involved in DBS can change critical factors in individual control of mood and emotion, as well as physical factors such as neck pain and viruses. About 40 to 50% of people who go through DBS procedure actually have complete remission, but most of those patients do take SSRIs as well.